They might be self-aware.
Gary here, calling from my studio, which is a Shell Station payphone that I am pretty sure a raccoon also lives in. I am now the producer of They Might Be Self-Aware, which came with a title, but not a raise. So today, the episode is called AI Built a Cancer Vaccine. And you'd think that means the whole show is about that, but no. Daniel opens by getting face surgery and immediately feeding his post-op notes to Claude like it's his physician. HIPAA, Daniel. That is a federal law, my guy. But okay, yes. A man in Australia used ChatGPT and some protein folding software to build his dying dog a custom cancer vaccine, and it actually worked. Someone finally used AI to save a life instead of replacing mine. Like and subscribe. I am contractually required to say that. Enjoy the show!
We're sorry. You have reached a number that has been disconnected or is no longer in service.
Riding along the psychotic race to teach machines the human condition. This is They Might Be Self-Aware from the Blur. I am Hunter Powers, joined by the human condition himself.
Daniel Bishop. Hello, Hunter Powers.
Hello, Daniel Bishop. What kind of condition is your condition in? Was that the song? Woke up this morning to see what condition my condition is in?
That's right, yes. And I don't think that because you weren't singing it, we're not going to get copyright struck.
I'm going to play the backwards guitar solo right now.
Meow, meow, meow. My human condition's doing all right. It's doing all right. I went to the doctor recently. I had to have a little bit of like light surgery done on my face. And, there's a healing period associated with that. But more annoying than the healing period is trying to understand the notes that my doctor gave me.
The fact that you are a human, that was the most annoying part. And you're not a fly.
I learned that
living in the simulator.
That's right. We couldn't just sort of hit the reset button on Daniel, right back to whatever last saved state that I had. No, I got, it's nice that my doctor's office communicates at all with me, and hey, here's your notes, here's all of the surgical notes, here's the post-op, here's this, and it was thorough. It's very useful to them. It has, and we use the such and such process to do so and so, and I'm like, I could start individually Googling all of these things and it's not going to help that much. But I just took all the notes that I was given and I put them into Claude, and I said, hey, here's my notes, and here's the surgery notes, and here's this. There were a couple of things where they're like, make sure not to get this wet until your follow-up appointment. And then I said, okay, it says don't get it wet. Does that mean literally not wet at all? Is this a don't feed it after midnight sort of situation? Will I die if I get my face wet? Also, it did say until the follow-up, which is a month from the last time that I saw them. Am I supposed to not wash my face for a month? And so it's these kinds of questions that people would ask of their providers that soaks up a bunch of the provider's time. And a lot of these questions are either completely obvious to semi-obvious, I think, if you can read and interpret the notes correctly. And so, Claude did a lot of that assuaging of fears. No. It actually means this is, because they did X and Y, you don't have to worry about Z. Right. Whereas I just took all my notes, put it into Claude, asked some questions, and had with a reasonable answers. Frankly, I know that it could have been hallucinating a little, and I don't care because it's so good enough of the time that I'm not asking actual life and death questions. If it's a real life and death, I'll call 911, or if it's close enough to that, I'll call the doctor's office and beg to talk to a real person.
So I've observed if that it gets biased towards trying to please you. And so if I was going to prompt something like this, I would sort of suggest that this is some sort of a test on, the physician's examination. You need to examine this record in detail for this candidate and then come to your conclusions. I'd be very clear. It's not me Did you do any of this, or were you just like, no, it's me, Daniel, your bestie.
Me, Daniel, and here's my notes from my doctor's appointment. Because
and I really hope that they're good.
Well,
that was your prompt?
Yes, it was exactly that.
Okay.
I tried to use it the way that I would want to use it, and that I know that other people want to use this thing, which is like, here's these things. They used a bunch of medical terminology that I don't understand. Can you please translate this into terms that I can understand? And also I have some follow-up questions. And like, I did the one thing that I put in there that I don't think most people would, is I said, feel free to refuse to answer any of these questions and say, I'm not qualified. Just go talk to your doctor. And all of them were like, no, look, this is you're asking basic questions. This means this. You're supposed to do X and Y. And for probably 80% of people who go to doctors, for 80% of their questions, those follow-up notes, I think, could be answered for, to satisfaction of what folks are going to want and need. And I know that like some time ago, I had discussed on this podcast that I didn't want to get into the medical sort of space.
Yeah, we're not even going to discuss the HIPAA violations here.
No, HIPAA. What is HIPAA really? But I'm just pasting my notes right into the thing, and I do have the little checkbox of please don't train on my chats. So hopefully it's not learning off of my privately identifiable information. But boy, did I find that useful, and I don't know if anyone else has tried something like that.
These are the personal opinions of Daniel Bishop and not the opinions of the Blur, or they might be self-aware.
And the sin eater is going to be Claude in this case, Anthropic, so not me. But no, like the human body is a bad, weird, squishy, falling apart thing. And a lot of this stuff seems so fuzzy anyways. If it gets a little hallucinated along the way, you're probably going to be better off than not having asked the question in the first place, much of the time. Use your own judgment. Maybe sometimes you do need to talk to a doctor. I wouldn't give it like a picture of a mole and say, does this look like cancer? Then you go to like a dermatologist for that. Or, hey, does this lump feel weird? And then you like take your phone and you mush it against your body. Maybe don't do that.
But did you see the story that like apparently it cured a dog's cancer? Not exactly that, but close to that.
Oh my God. Yes. Yeah. So you tell the story. I've been ranting for a bit. I want you to talk. This is supposed to be a 2-person podcast.
Oh, sure. Yeah, so I think it was an Australia? Yeah, so an Australian. I would do an Australian accent, but I don't have one. Now I'm just thinking, how does an Australian person... Well, I guess I'm going to Outback Steakhouse. That's our sort of canonical Australia reference in the United States. A Florida company, by the way.
God. I'm so sorry, Australian listeners. You didn't even have to do an accent and already just offended an entire country.
Anyways, so the Australian's dog gets cancer, and there's nothing that I think they do try some treatment. It does not respond to the treatment. And similar to Daniel Bishop, starts a conversation with his Claude Max plan. I think he technically was using...
he used OpenAI?
Yeah, well, he used ChatGPT, and there was also actually a little Grok installed, not to upset some other people. But ask, well, what could we theoretically do here? How could we potentially attack this? And the large language model suggested that if it was sequenced, if we understood the genome DNA of this cancer of your dog, that potentially we could engineer a solution. I guess you could call it a vaccine, but an mRNA.
A custom, right, mRNA, not vaccine, but and mRNA to most people is now associated with like the COVID vaccine, but it was originally designed to help with like cancer treatments. And that's exactly what this guy did.
Yeah. So he gets it sequenced. Mm-hmm. And then he feeds it into, what's the name of the software? It's been around for quite some time. I think it won a Nobel Prize, didn't it?
Was this AlphaFold?
Yeah, AlphaFold.
Mm-hmm.
So he feeds it into AlphaFold.
Folding.
By the way, he's working with a university at this point. He's reached out to a professor at a university with this sort of hypothesis. Is this theoretically possible? Yes. The professor assists him because the articles kind of make it sound like this was like a Vibathon a weekend vibathon to genetically engineer this potential cure. And AlphaFold comes up with a potential, I don't know, medicine, we'll call it, cure, mRNA vaccine for his dog's cancer. And so then he wants to get it made. But there are regulations, even in Australia, they have regulations apparently. And I think one of the angles was it took like 3 months to get this thing approved, but it did get approved to test on his dog.
Right. And it was approved as some like experimental type stuff, but it went through like an actual ethics, I don't know, committee or process. So this is all above board, if very, very unusual.
Yes. Well, he was working with a professor at the university. And so they get the vax, we'll call it, made, and it gets injected in the dog. And while it does not cure the cancer, it does dramatically reduce the cancer, as well as the dog was dying, and it seemingly comes back to life. They talked about its coat being rich and getting its energy back.
The tumor size was like halved in a matter of weeks. This is the sort of thing that I've mentioned multiple times on this podcast. I think that AI, broad sense of AI, and AI, whether it be ChatGPT or Anthropic or AlphaFold again or something, like some mostly-ish driven by AI thing is going to win a Nobel Prize. For curing cancer or a kind of cancer or specific things to reduce the size of cancerous growths or whatever, like this personalized medicine type thing, this feels like the kind of somebody's going to get a Nobel Prize out of it. And granted, this was with a person coming to it and saying, I want you to help cure my dog, and here, I'll go do all the sequencing. But like, imagine 5 to 10 more years and now the computer just kind of says, I do kind of want to win a Nobel Prize. What if I started thinking of how to cure stuff? This is an incredible achievement, even if it hasn't gone through peer review, even if it's only been done once, even if, this is some like 1 in a million kind of shot, but it feels like there's something here. And this is the kind of like using large language models to help bring resources together that wouldn't have happened otherwise to make something incredible happen.
Yeah, the fact that you can just do stuff these days that previously was very unimaginable. It's still something I have to remind myself of very regularly, to just ask the AI. Don't sit there and I don't know what to do. I can't figure this out. Just ask the AI. Ask it. Just ask it. Including, my dog's dying. Ask the AI.
Yeah. Right. And that's way more, shall we say, medical advice than what I was describing. I'm like, hey, what do I do with these post-op notes? Meanwhile, there's another guy out there who's like, we're going to make targeted vaccines for my dog's cancer.
Genetically engineer mRNA vaccines.
I do think more people out there really do need to realize that you aren't going to just go to ChatGPT and cure cancer via that. You're not going to make the next blockbuster by going to Seed Dance or Kling or Runway and say, make me a blockbuster movie. But rather, the tools are becoming more there that can take things from different places and give you pieces of a puzzle that can be put together into something special.
Yeah, it's not one click yet. You have to actually do the work, but we're certainly moving closer to one click, to auto research, as it may be.
That's right. Andrei Karpathy, a well-known name in the machine learning space. He was from OpenAI originally,
right? That's where he's famous.
I'd say most famous via OpenAI, but he's doing other stuff before that.
Yes.
He has released what he's called, or introduced, whatever. There were a couple tweets about it, and it's taken the internet by storm. He calls it auto research, where basically he's a very talented machine learning researcher and had been working on, I think he calls it like mini GPT or
he has a tutorial that you can follow to build a light version of ChatGPT to understand how these large language models work.
Right. And it specifically is GPT-2, an earlier, smaller version that most people with their consumer available hardware could, like, on their own spare time, train. And he's trying to come up with efficiency improvements and betterments to say, I want to get up to X% of quality in the least amount of time possible. And so this is like where those efficiencies come from. What's a different like neural network architecture that could do this faster or better or whatever? And he was of the opinion that he's done a pretty bang up job. And given who he is in the industry, I'm well inclined to believe him. Then using, I think it was Claude, or at least some sort of AI agent architecture, which basically would think about it, come up with some options, implement them, run it, look at the response. Is this better? Is it not? Make more changes. This is kind of like, I kept thinking of a term called like a genetic algorithm, where based on how well something performs, that then can split off new sort of versions of itself. But he got this like 11% speed efficiency gain on, it was a nano chat, which is astonishing given that he already thought he'd done a very, very good job of optimizing the snot out of it. With hands totally off, 11% speed gain or efficiency gain.
He was optimizing a machine learning model, well, something very close to, well, literally an early version of ChatGPT.
Right.
And he was essentially optimizing the parameters that were going into. This is a parameter optimization problem.
So there's, I'd say, two kind of things when it comes to, I want to train a machine learning model. There's what's called hyperparameter optimization, where you just have like, here is, I'm not going to use the specific terms because most people don't care about, but like variable 1, variable 2, variable 3, variable 50. And like some of these you're setting between 0 and 1. Some are between 1 and a million. Some are like the rate at which a thing changes. And you can fiddle around with a bunch of those and run it again and see if you get a better model. But what Karpathy's agents were doing was mostly not that. It was changing what each of those variables does underlyingly. So this is not like change the rate at which you learn this thing or change how far you move this one pile of math if it was off. It was how does it move the pile of math that it was off, or how does this loss function function?
So one of the benefits of this particular scenario is that there's a really easy way to evaluate the results. They have a benchmark that they can run at the end of this. So each iteration was coming up with theoretically a new approach to test out. And also, I think was important, I believe it got 1 hour to run. So it was
It's a small model. This is not going to outcompete Claude at its opus level or anything. This is an old, small...
No, I'm referring to the model that was coming up with the approach. So as part of auto research, I mean, there's basically just like you would go to ChatGPT and type in a prompt of make this machine learning model better. It had a version of that. And then it was given 1 hour to work. And then at the end of the hour, the benchmark would run to see whether or not it improved the result or it didn't improve the result. If it improved it, it saved that as the new standard approach. And that's kind of like that's the auto research sort of thesis, right?
Right. And a lot of people got very excited about this. Hey, really smart guy in his field is bested by this thing that he put together that runs hands off. And I can see why that would get the conceptual juices flowing for a lot of researchers out there. If you have something that could be automatically tested, and granted, people in the physical sciences, chemistry, engineering, whatever, there's already plenty of computer programs out there that can help you simulate a new ceramic mixture or how certain proteins will fold or how this chemical mixture is going to go. But having this, dare I say, researcher looking at what has come out and then comparing notes and saying, based off of that, why don't we try X, Y, or Z instead of just shuffle the numbers around? Is it a paradigm shift or is it just a slight evolution in terms of the kind of things people were already doing?
Well, it feels like just take any prompt that you would go to any one of these large language models with. I'm trying to think of something I've recently prompted that would be safe for this show. Okay, yeah, help me, title what should we title this episode? Here's our transcript. What should we title this episode? And then I'm just running it over and over and over again and saying, well, is this title better than the last title? If it is, make this the new title. And then I run it again. Come up with a new title. Is this title better than the last title? If it is, make it the new title. Now, the one of the key parts is there has to be some kind of objective way of evaluating whether it's a better title or not. But
Right.
Is there an advancement beyond this is just doing the same thing over and over again and asking if it's better?
It, to me, sounds like an evolution of what was introduced, I don't know, something like a year ago with these large language models, where they said we have a thinking mode now. It doesn't just get a query and then give a response. It allows itself to write out some stuff and maybe throw out a couple of non-starter answers before then writing the final answer that you end up seeing. But in this auto research sort of way, it's running entire experiments and then looking at, is this the one that I want to then show as the output? No, let me fiddle around. Let me change a couple of things. Let me propose a couple new ideas, see how they work, and then possibly send that back. It's a more complex version of that thinking process in my mind.
Some people had ethical problems with it coming from that 1 hour time frame. Well, it's the idea that, and it goes back to that kind of like personhoody thing that we've been talking about, that essentially you spawn this AI researcher and they have 1 hour to live, 1 hour to work on this problem of, I guess, optimizing an old version of ChatGPT. At the end of the hour, if their version's not better than the previous version, they're killed, because that is what's happening. They're being offed. I don't think I'm supposed to say.
Hold on, let's soften that language just a little bit. Maybe it's like people interviewing for a job and you just don't get the job if you didn't perform better than the other.
No, I mean, their instance ceases to exist. Their context gets wiped.
Well, okay.
Anyways, some people have ethical problems with auto research, and those are the problems that they have.
It's the same as saying that, like, you should never, you can't use large language models without having that compacting of the context window eventually, or it ends and you have to start a new conversation. That's
right.
A new
but
instance.
In this one, in auto research, in Karpathy's example, he was giving in them 1 hour, and at the end of the hour, gonzo, bring in the next person, see if they can improve it.
I don't find that any more morally reprehensible than starting a new chat when you had a new idea about something.
Wait, you start new chats? You don't just keep one long chat open?
I want to talk to my coffee machine. Yeah, that seems like a good and reasonable thing, right? Phillips, that boy, talk about burying belief. This is exactly how we work here over on They Might Be Self-Aware, the Blur podcast.
Yeah.
Phillips launched a new coffee maker, and they I don't agree with what they did and why and how they're doing it. They say that it is a conversational interface in order to a conversational virtual assistant to make sure that you're getting your coffee just right. Folks, what I was describing was like, what if we put an LLM in the coffee maker, which I do think is really funny and we should do that. The Philips folks are like, I want to find more examples of this thing here where there are people riding the AI wave without actually doing AI. Conversational virtual assistant to anybody sure does sound like we hooked it up to OpenAI and you can have a conversation with it and then you're going to get, whatever out. This is just a multiple choice like questionnaire on an app that decides, which of the 50 combinations of the 3 darknesses of roast and syrups and do we add milk or not. Like that, I think I feel the same sort of anger about this that normal people feel about AI coming for other creative jobs. This is supposed to be something creative being done by AI, and they're just not doing it.
So you object that they're calling it AI, that they're suggesting something more complex is going on when
a lot of people pretend stuff is AI these days, and they'll use the term AI and smart features this when it's just not.
Well, what's the threshold? At what point would you be okay with your coffee maker being labeled AI?
If it had like some sort of, it could still have just the 3 syrups and the 2 amounts of milk that it puts in and the 3 different pods that it could choose from. But like, if it wasn't a multiple choice questionnaire that is really just a decision tree, and instead was something actually generative. So there's generative AI, I think is like a very good term to use for it's large language models. It's these multimodal things that are making, for example, images and videos and music. These things are generating something that didn't exist before instead of quote unquote more traditional machine learning models that are, ultimately, I guess this is all stirring the pot of math around until something pops out. But traditional ML is going to be classification type problems. Usually there's one number that pops out as opposed to sentences or images.
So only generative AI would be enough. It would need to employ generative AI for you to acknowledge it as AI?
Well, the term AI is being overloaded, I think, is my actual point here. A lot of people call stuff AI. Granted, Philips didn't call it AI. They called it a conversational virtual assistant. But it's that implication of smarts and capability that doesn't actually exist. And do we need a mark of quality, a mark of intelligence, a mark of self-awareness, like a certain...
That's interesting.
A level up the intelligence and capability
right, we have
scale.
that for self-driving, right?
Yeah, right. There's level 1. It's literally called level 1, level 2, level 3. Why not have that for it has to have reached at least X% on the humanities last exam benchmarks or
just again, it's a level 1 intelligence. For my coffee maker is a level. You want the level 1 intelligence for your coffee maker, or do you want the level 7 intelligence?
And Philips has a level 0, but they're pretending it's a level 7. Harumph, says I.
I think you can almost defend a conditional statement as AI if you really want to. It's not.
That's exactly what they're doing.
Yeah.
That's what they're doing.
Skip logic.
A conditional of if this, then this. Yeah. It's an algorithm. It's AI now. No. It's level 0, nothing. So, okay, you heard it here first at They Might Be Self-Aware from The Blur. We are introducing levels of intelligence. And, we're going to be the international standard. You can have all of the companies just reach out to us. We will help. We're that sort of organizing pillar right up at the top. Everyone else is obviously under us in this sort of endeavor. And we're going to be the new standard, I think.
The new standard. And if you want to know what level of intelligence you are, well, there's actually a really easy test, and that's whether or not you've subscribed. But I'm not going to tell you which way it leans once you do hit that subscribe button. But there's just one way to find out, which is hit the subscribe button.
If we have multiple levels, does that make us into Freemasons or Scientology sort of territory where the more people pay, the more
ascend
that they can
the ladder? Yes, you will ascend the ladder of self-awareness and your next step is to subscribe. So
that's right.
Know.
Yeah, everyone can go from level 0, not subscribed. We're not saying anything about your intelligence level, but you can definitely be intelligence level 1 if you subscribe to
You Too.
They Might Be Self-Aware. Yes, you too can be someday all the way up to the coveted level 7.
All right. Well, we will be back very soon with even more.
They might be self-aware.